As a mentor in the Feeding Mentorship Program, my favorite part is passing on my passion to other therapists. I have a love for this specialty of feeding, and there's a lot of families and patients out there that need feeding therapists, and they're in high demand. And if I can build that passion that I have in someone else and watch it bloom in someone else, it's just so rewarding. And seeing other families that might not have had a feeding therapist progress, and seeing those patients get their needs met with a feeding therapist and expanding our reach is huge. I'm helping another therapist learn and dive into something I'm passionate about, and then I'm also helping reach families, not myself directly, but those therapists. They get to expand out and help these kiddos with feeding, which can be such a basic need. And families get so desperate, my kid won't eat. It's scary as a parent. And if you can help that kid eat and help that family feel successful and see that progress on one of life's basic necessities, it's just so rewarding. And so helping others reach those families and helping others find that passion that I have makes it just a rewarding program. And it's why I keep doing it, why I keep getting more mentees and give them all to me. I love to work and train and lead and helping other therapists find that confidence and grow. It's just so rewarding. As a mentor in the Feeding Mentorship Program, I have definitely expanded my skill set, and it's really carried over into my own practice. As a teacher, you have to approach things differently. It's not just actions. You have to explain and, write down and talk through the strategies. Why are you doing this? And having that approach makes me rethink why I do things, how I do things. We do a lot of coaching with parents. That's a big part of feeding therapy. But when you take it from a teaching aspect to teach a therapist how to become a feeding specialist, you have to rethink how you explain things, talk through things to make sure that they're going to be successful. So it helps me build my skill set and my education if I am looking at different ways to explain and teach my mentees. And also on that, my mentees are having their own feeding caseload, their own feeding patients. So I get to see and talk to and reach a lot more families and patients that aren't on my own caseload. And I might get a feeding mentee that has a child with a syndrome I've never worked with. Ooh, this is interesting. Now I get to learn about this syndrome and how feeding's affected this child, and I get to expand on my skill set on a kiddo I might not have had. And so that helps me to get more experience.